So, we are the Children's Mental Health Resource Center, and you can call us by our full name, or you can call us CMHRC, um, or you can call us um, the Resource Center. Whatever you're most comfortable with and is the easiest. We know that this is kind of a mouthful. So, our mission is simple, and it's to provide guidance and resources for the early identification and management of mood disorders, bipolar disorder, and its newly identified phenotype, which is called fear of harm. Um, all that is something of a mouthful. And so, to put it more simply, our mission is summed up quite nicely in our sort of unofficial tagline. And I know I use this over and over again on social media and in our newsletters, and basically every time I speak with a family. And that tagline is simply that you're not alone and we're here to help. So who are we and what do we do? So my name is Elizabeth Errico. I am the founder and executive director of the Children's Mental Health Resource Center, and my second in command, so to speak, and partner is Jennifer Sevick, who is the clinical coordinator for CMHRC. And supporting us, we have a extensive team of board members, staff, contractors, volunteers, and advisors who are all committed to our mission. Now, most organizations will say that everyone is committed to the mission. I'm sure it's usually true, but in our case, it really is, and I can tell you why. First, Jen and I are both licensed mental health professionals. Together, we have a combined nearly 50 years of experience working in the mental health sector. And when you add to it the additional experience of our team, which includes other mental health professionals, that number jumps to nearly 100 years of combined experience working with children and families. Additionally, like most Americans, Jen and I are also family to people living with mental illness. And in fact, almost everyone involved with the Children's Mental Health Resource Center has had their personal lives touched by someone who is living with the mental illnesses that we address. Again, those are mood disorders, bipolar disorder, and its newly identified phenotype, fear of harm. And that's why we can say at the Children's Mental Health Resource Center that we are entirely for, by, and about families living with mental illness. And we're a community representing the lived experience of mental illness. And our work is rooted in this fundamental truth that early intervention is the best tool for positive long-term outcomes. Now, identifying and treating mental illness in childhood may still feel controversial to some, but to us, we know that it saves lives and allows children and families to thrive right now and in the future. We are also rooted in the knowledge that no one should have to face these illnesses alone. But unfortunately, that is often what happens. Most families with a child who struggles with mental illness feel isolated, they feel alone and misunderstood, oftentimes even by their family and friends who want to help. But just don't have that shared experience to understand. Worse yet, the mental health care system is often confusing, unintuitive, and honestly, so overwhelmed by demand that it's often very difficult for families to figure out what kind of help they need or how to get it. So at CMHRC, we're here to help families navigate this complex mental health care system, navigate the other systems that intersect with it within the community, at their schools, and in their homes, And we're also here to help the practitioners with whom they work who may not have yet been trained on the newest research into the causes and treatments of mood disorders, bipolar disorder, and fear of harm in kids. And so the way we accomplish this is through a series of programs and services that are designed to support everyone in our community, from parents and caregivers to their mental and physical health care providers and their school personnel. Since we are building a community, it's important for us to emphasize that we are not a nameless, faceless organization. We are, in fact, a destination where families and practitioners can come together to work together, to learn, to connect, and to find solutions together. This coming together happens through our first program, which is our membership program, which we offer in 3 different tiers. Now, membership for families and caregivers includes, first and foremost, access to weekly online support groups for parents and caregivers. These meet multiple times a week in different time zones, making them accessible for anyone, anywhere. We've had people as far away as New Zealand and Singapore join our groups. I don't do the time zone calculations on that. They have to do it themselves, but they're welcome to join. Our groups are made up of a wide range of families, from those who are just starting out on the journey of learning about this to those whose children have been stable for several years. We have families whose children are as young as age 6, and families with children who are in their 30s and 40s. During these sessions, parents share information about strategies and techniques that they're using that are effective. They talk about how they're coping. They ask questions. They provide one another with support and understanding and inspiration, quite frankly, through an amazing mixture of understanding and humor and kindness. And honestly, the family support groups are, those are some of the most amazing people that I've ever met. And if that were the only service that came along with membership, it would be well worth the price of admission. But it's not the only thing. In fact, there's quite a lot more that we offer. Being a family member also includes access to our member toolkit. This is a web app that is coming very soon. And I have to say, I am extremely excited about it. And so excited that I am going to include a bunch of screenshots of it in action so people can see. The Member Toolkit app will track daily symptom presentation, and it is entirely customizable for you, for your or your child's symptoms. And so with just a few quick taps, you're able to document anywhere from 4 to 10 symptoms every day with a totally straightforward interface that makes it really easy to see how prevalent or significant the symptoms are each day. The Member Toolkit app will track daily symptoms and show you visualizations, graphic visualizations of each symptom so that you can compare how its prevalence and severity over the course of weeks or months or even the year. Then you'll also be able to customize the toolkit with the medications and supplements that you or your child take to document when they were started. And each day when you log your symptoms, you're also asked to log whether or not those medications were taken as prescribed. You have the opportunity to change doses, document that you stopped taking it, and if so, why you stopped taking it. Maybe it wasn't helping, maybe it was making symptoms worse. And some of you may already know why I'm totally geeking out over this, because by logging medication compliance and changes in medication and effects of medication, you really quickly get a very clear picture, especially when you compare it next to symptom presentation, how effective the medications you're taking are and how they impact stability, which is incredibly important in terms of managing long-term wellness and being able to communicate with your providers around what is and isn't working for your treatment. Lastly, the member toolkit also automatically logs each day's weather. So for those who understand how closely weather impacts symptoms, especially those of fear of harm, the member toolkit displays your location's weather on your daily log, and it's there so you can compare symptom prevalence with weather. Okay, as if that wasn't enough, the membership also includes access to our private unsearchable social media group and access to our private archives, which I call our resource library. And here we have a complete archive of every webinar that we host. There are educational videos. There's a weekly Your Questions Answered series that if any of you are already members, you hopefully have been able to check out, where we answer questions from, what's the difference between mania and hypomania, to what's a mixed state, to why is boredom such a trigger for bipolar and fear of harm symptoms. We also have an archive of parent testimonials and stories. And honestly, I have to say that this is an incredibly moving archive. These are real personal stories written by real families in our community that document their experience of going from the chaos of untreated symptoms to some semblance of stability, of getting their lives back and watching their children be able to thrive. And it's really incredibly moving, and it will make anyone who is struggling with these disorders really realize that they're not alone. We also have a new series that we're launching very soon, which is layman's summaries of important research papers. So much is changing in the field of psychology and psychiatry. Every day we're realizing that there are more and more physical symptoms and mind-body connections that influence symptom presentation and disease onset. And it can be frustrating not to be able to read all of that literature if you don't have a PhD in research methods and statistics. But what we have is we have a professor of developmental psychology and research methodology and statistics who is creating an archive for us of layman's translations of important research papers so that families can stay up to date on what's going on in the field. And best of all, maybe, is that families who are members get a 75% discount on our community advocacy program. We have a similar membership program for mental health professionals with some similar aspects, but also with different ones that were designed by clinicians for clinicians. And these include a monthly peer supervision sessions for professionals who are treating kids with mood disorders, bipolar disorder, and fear of harm. It allows you access to screening and diagnostic materials, and that also includes a professional account for the member toolkit so that you can share it with your patients and you can see real-time data on how they're doing. We also provide best practices support through peer-reviewed published research. We have, and we're developing right now, I should say, educational and lecture materials and presentations that professionals can take and use to educate their local community of professionals. And it also, membership for mental health professionals allows them access to all of the same information in the resource library. We have a third tier of membership, which is for schools, and this is slightly different. The school membership allows for trainings of special education staff and ongoing consultation with special education staff in order to educate them on how these disorders present in school and the unique needs and accommodations for kids who have them in the classroom. We have 4 additional service programs that support our goal of getting kids and families access to accurate diagnoses and effective treatment. And anyone can make an appointment themselves through our website to schedule a consultation for any of these programs and services. You can go to our website, cmhrc.org/services, and you will see links to schedule consultations, or you can email admin@cmhrc.org or info@cmhrc.org. And as I said, you will book a free consultation with us. So these service and programs, there are 4 primary ones in addition to membership. There's our diagnostic consultation program, our community mental health advocacy program, our school advocacy program, and our transition support. The diagnostic consultation program essentially serves to bridge the gaps between a family's understanding of their child's diagnosis and access to treatment. And so we do several different things within this program. Families can come to us and talk to us and say, we received this diagnosis and a prescription, but we don't understand what it means. We don't understand what we're supposed to be looking for. We don't know how we're supposed to be managing this at home. And we can provide you with confirmation of the diagnosis, explanations on what it is, assistance on understanding what the medications are, why you're taking them, what you're supposed to be looking for in terms of medication success or failure, and how to manage the symptoms at home. We also provide a diagnostic review that includes extensive online assessment surveys, a clinical interview, and a case history review that we do with you. We provide education and coaching on communicating and advocating for yourself or your child with your existing providers. And we do a consultation with those providers on your behalf, both physical and mental health care providers, so that they can understand the diagnosis that you may have. And we provide you with a detailed report that includes all of the assessment results, all of the diagnostic criteria with symptom comparison and analysis. We provide best practices and research summaries, and we provide a compilation of the relevant peer-reviewed published papers that outline the diagnostic and treatment processes for the disorders that you or your child may have. Our next service is our community mental health advocacy, and this really focuses on how we can empower parents and families to be able to communicate effectively with their existing providers. CMHRC experts will go in and meet with your providers on your behalf, support them, give them the resources that they need to help you and your family. This involves confidential consultation with us where we plan your advocacy, we answer all your questions. We have private consultation sessions with each of your providers. We provide follow-up information to you on those sessions so that you are apprised of the latest communications that have taken place on your behalf. And we offer an optional team meeting in which you, your family, your providers all meet with your CMHRC advocate to answer questions and ensure that everyone is on the same page. This service is, the fees are based on how many hours it takes to complete all of this. There's no fixed amount of time. And as I mentioned earlier, families with memberships get a 75% discount on this particular service. Our third service is our school advocacy program. Kids who have mood disorders, bipolar disorder, and fear of harm have symptoms that impact their ability to learn, to attend in school, and to be successful based on the school's expectations. And so what this program does is we work with a family directly to make sure that their child has the accommodations within their IEP and 504 plans that are necessary so that they can be successful in school. This program, we offer private planning sessions and debriefing meetings with your advocate. We conduct one-on-one consultations with your school's staff. We virtually attend all of your IEP and 504 meetings with you. We help build cooperative communication tools so that the communication going from school to home and from home to school is clear, cooperative, and collaborative. And we provide information on mental illness in children to the school so that they understand the behaviors that they're seeing at school, the behaviors that might be triggered by school. And we suggest concrete, specific accommodations and interventions that will help manage those symptoms at school. This is a comprehensive program. We work with families for the full school year in order to ensure not just that these IEPs and 504 plans are developed, but also that they are implemented and executed effectively throughout the school year. And the fourth service program that we have is our transition support. Sometimes, for various reasons, you have to change providers, either psychiatrists or pediatricians or therapists or schools. And you may be unsure of how to make that change, what information you need to share. And what we do is we come in and help smooth that transition with mental health experts who can walk you through the process of what information you need to share, how to share it, how to communicate what your needs are and what you're looking for in a provider. Very often, because our system is overwhelmed, families feel as though they are auditioning to be accepted by a practitioner. And we really try to help families understand that they're interviewing providers to figure out who's going to be the best fit for their family. And that is something that we want to empower families to be able to do with confidence. And so through confidential consultations, we review your child's illness history and devise a transition plan with you. We provide education and coaching on how to present your child's diagnosis and treatment history, how symptoms have presented in the past, and on how to communicate and advocate effectively with your providers. Sometimes when you change providers, the provider may say, well, you have this diagnosis, but I don't see any of these symptoms. And so we're able to help you communicate with them about what it was like before and why the current treatment plan that you have, if it works, needs to be maintained, or why the treatment plan you have that isn't working needs to be tweaked and in what ways. As part of this service, we also provide consultation and advocacy on your behalf with your new mental health care provider. You can contact us or learn more about any of these services by going to our website, which is www.cmhrc.org. You can learn more about our specific services by going to cmhrc.org/services. Or again, you can email us at admin@cmhrc.org or info@cmhrc.org. You can sign up on our website to become a family, professional, or school member. And you can pay for that on a small monthly fee, or you can get a 2 months free by signing up for a 1-year membership. We also have a series of free resources that are available to anyone and everyone, and that includes these monthly webinars. It also includes our new book club that is led by Jen and me. Our first book is going to be The Bipolar Child by Dr. Dimitri Popoulos. This book is going to be discussed in 3 parts. The book is broken into 3 parts. So the first part will be discussed on February 21st, the second part on March 21st, and the third on April 18th. You can sign up to register for that book club on our website's homepage. We also have the free resource of our Read, Watch, Listen archive, which is a compilation of articles, videos, and podcasts that have been appreciated and enjoyed by members of our community. They share with us and we share with you. We also have a list of recommended products that follows the same premise. Members of our community have tried these products, feel that they are useful in helping manage symptoms, and they recommend them to us and we share them with you. We also have information on mood disorders, bipolar disorder, and fear of harm that is available. And we have information on the DSM diagnoses. We have all of the criteria listed for all of the diagnoses that are usually given to children, so that we can demystify what's going on when your providers pick up that book of the Diagnostic and Statistical Manual of Mental Disorders. We also have a list of relevant research papers that you may want to look at, but all of those layman summaries that I talked about are reserved for members. Please remember that this journey to stability is a marathon and not a sprint. And there's no reason you have to do it alone, and there's no reason that you have to reinvent the wheel. We are here to help you walk this path to stability and healing, just as we have done with countless other families. Because again, no one needs to face this alone, and we are here to help.